Many people still assume that there's very little scientific evidence regarding complementary and alternative medicine therapies. But the truth is, many of these approaches can have an enormous impact on your health and well-being. Here are a few to consider. Aromatherapy can be used to treat stress, sleep disorders, and mood disturbances, including depression and anxiety. Acupuncture has been proven effective in treating conditions including migraines, chronic pain, and insomnia. Massage can help treat migraines, improve sleep quality, enhance immune function, and reduce low back pain. Using the principle that touch is healing, massage involves rubbing the soft tissues of the body, such as the muscles and connective tissues, to release tension or treat injury. Aside from being the ultimate in relaxation, massage works to reduce inflammation and stimulate the healing of connective tissues or damaged muscles. Consider giving these therapies a try to live a healthier, happier life.
So complementary and alternative medicine is any practice of medicine that is outside mainstream conventional or allopathic medicine. The World Health Organization estimates that between 65 and 85% of the world's population, that is over 4 billion people, rely on alternative medicine as a primary form of healthcare, compared to only about 10 to 30% of people who use conventional medicine. Traditional Chinese medicine has been chosen by the WHO for worldwide propagation to meet the healthcare needs of the 21st century. Alternative medicine may be sourced from natural herbs and are referred to as herbal medicines. They are used alongside conventional medicines as remedies for a variety of ailments like coughs, insomnia, dietary supplements, and weight loss. Now the questions often asked are, how safe are these alternative medicines? Do they really work? Who's authorized to prescribe these products? Who's authorized to consult and treat patients the alternative way? How do these forms of treatments really work? Well, these are questions we'll tackle in today's show. Our guest panel today includes the Registrar of the Allied Health Professions Council of South Africa to guide us through regulation issues for the profession. Now we'll also get a glimpse of different types of chem methods from a traditional Chinese medicine practitioner, a homeopath and acupuncturist, and a chiropractor. So sit back, relax, and learn from this exciting show ahead. You can interact with us via our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Solomon Daoud. This is Health Talk. The chem industry in South Africa is said to be worth about 8 billion rands. The popularity of chem has resulted in calls for it to be integrated into the country's healthcare and medical education system. While scientific evidence exists regarding some chem therapies, for most, there are key questions that are yet to be answered through well-designed scientific studies. Questions, for instance, such as whether these therapies are safe and whether or not they work for the purposes for which they are used. So, to learn a lot more about these, let's welcome this morning Dr. Louis Malinda. Dr. Malinda is the Registrar of the Allied Health Profession Council of South Africa. Welcome to Health Talk, Dr. Malinda.
Thank you very much, and good morning to your viewers.
All right. So as we saw in the clip, I mean, when it ends, it says, to live happier and healthier lives through these alternative, complementary and alternative methods. Perhaps let's start with the basics. Just define to us what chem is, complementary and alternative medicine. What exactly is that?
Well, as you, in your introduction, you indicated that complementary medicine was that which is systems of medicine, traditional or otherwise, outside of the conventional mainstream medical model, which is largely a Western model as such. Mm-hmm.
Mm-hmm. Now, we often hear of traditional medicine. How does this come into being now? Is it any different from all of these?
Well, I think we should look to, say, the traditional medicines of India, which, for example, is Ayurveda.
Yeah.
We have a traditional medicine system in this country itself, and it's estimated, I think, that for every 4,000 persons in this country, we have one traditional healer, whereas for every 44,000 persons, we have one conventional doctor in this country. So you will appreciate that for many persons in our country, the first port of call is actually a traditional healer, either Sangoma, Nyanka, or we also have the doulas and the circumcision surgeons. So yes.
Okay, so obviously we're focusing for this show on complementary and alternative medicine. You, the Registrar of the Allied Health Professions Council of South Africa.
That is correct.
And clearly this is with the view that, the profession has to be regulated and so on.
That's right.
Just take us through, firstly, the history of, the profession.
The history goes back, I think, to about 1983, where government recognized chiropractic and homeopathy as complementary medicine professions, and it progressed. And in 2001, legislation was changed, and we now have 11 professions registered under council. So we look to homeopathy, naturopathy, phytotherapy, which is the use of herbs in the Western sense, chiropractic, osteopathy. We look at Ayurveda, traditional system of medicine from India, Chinese medicine and acupuncture. We also regulate Unani Tib, which is Arabic medicine based on the teachings of Hippocrates. And we regulate 3 therapies, namely aromatherapy, reflexology and massage therapy.
Interesting. So there's about how many? 11.
11 professions, indeed.
Why did it take so long for recognition of the profession in this country when in fact the actual practice has been there for many, many years?
Well, I think we're actually very fortunate in this country in that these professions are recognized in law. That is not the case in most other countries in the world, with the exception maybe of the UK, the Netherlands, Australia and Canada.
Right.
So I think that government recognizes that the practice of the medicine and the professions has to be regulated, and of course it is the function of council to also set standards for education and training to ensure that our practitioners are competent to enter the professions.
Right. Okay, you mentioned obviously there's 11 different types of fields, as it were. In terms of the spread and the number of registered practitioners, do you want to just give us a sense of how many?
I certainly can do that. The fact of the matter is that the total number of complementary medicine practitioners is about 2,600 throughout the country. Our largest grouping is the chiropractors with about 770, followed by homeopaths at 573, followed by reflexologists at 550, and so on. Our smallest profession is in fact Ayurveda. We have 17 registered practitioners in Ayurveda.
The so-called herbalists, do they form part of?
No, you will. There are 6 statutory health councils in this country, of which we are one. But promulgation of legislation means that there is now an interim traditional health practitioners council, and the herbalists will resort under that council. Yes.
All right. Okay. Has legislation been passed, just out of interest, on the traditional medicine side, by the way?
Not yet, as far as I'm aware.
Okay.
That is, of course, a matter for the MCC as to how they wish to regulate that.
Okay. Back to chem. I mean, 2,600 sounds like a small number. Are we reasonably satisfied that everybody that is practicing chem is registered in this country?
No, we're not, because there are in fact many persons practicing our professions unlawfully. In terms of the legal system in this country, that is a matter for the South African Police Force or services to tackle. It's a criminal offence. By the same token, there are many institutions of education and training which are offering our qualifications unlawfully. But that is a question for the Department of Higher Education and Training to address. But if any person wishes to be treated by a person in any one of our professions, they're always welcome to go onto our website. The registers are published. Or they're welcome to phone Council House, and we will provide them with names, or indeed to go to the professional associations. By the same token, all the accredited institutions of education and training are listed on our website as well.
So for any member of the public watching this show and saying, you know what, I've been going to this homeopath down the road or the chiropractor down the road, how can I be sure that I'm consulting somebody who is registered? You're saying that the options are to either phone the council?
Yes.
But isn't there like a sign that says I'm a registered?
Indeed, the certificate of registration is required by law to be displayed on the practice wall or in the practice rooms. But you can also, of course, check via the website or phone us.
Okay. Let's talk about training then. I mean, obviously, we don't have time to go through all the 11.
Well, very briefly, education and training in homeopathy and chiropractic, 5 years master's degree, either at the University of Johannesburg or the Durban University of Technology. Naturopathy, phytotherapy, Unani Tib, Chinese medicine and acupuncture at the University of the Western Cape. At this stage, a double bachelor's degree. Ayurveda is not taught in this country, and nor is osteopathy. And the three therapies are taught at various private institutions of higher education and training.
So those that are not taught in this country, are they necessarily practiced in this country?
They are. Ayurveda and osteopathy are practiced in this country. Council has a policy by which we verify those qualifications, and in fact those persons are also sometimes subject to review assessments to ensure competency to enter the profession.
Okay. I mean, there's often a grey zone, if you like, between alternative, complementary and allopathic when it comes to perhaps treatment of certain common conditions, say for argument's sake, backache, okay, that chiropractors would treat, allopathic medicine guys, would treat. Let's talk a bit about the scope of practice for the profession.
Well, the point is that scopes of practice can and do overlap in many professions.
Yeah.
So the fact of the matter is our practitioners are well versed in anatomy, physiology, pathophysiology and pathology. Those conditions are understood perfectly. It is the method of treatment that may differ from the conventional medicine sense. So where lower back pain might be treated using a pain pill or an anti-inflammatory, a chiropractor might adjust. A massage or manipulate. A massage therapist will massage. So in a sense, the problem, the condition is the same. The treatment modalities differ. But in this country, we do not recognize the concept of integrative medicine in the South African medico-legal paradigm. So if a conventional doctor were to wish to treat using acupuncture, he or she would have to be registered with our council as well. Dual registration is required.
Just the last question in this. Clearly there's issues of safety, which is a great concern, to say that, I mean, there's a whole lot of these products that are classified as chem products that have not been registered, and there are no signs that, they're safe and so on. Where are we in terms of getting all of these registered through the MCC?
The MCC, or the Minister of Health rather, promulgated Regulation 25A in I think about 2013 or 2014. There will be a call-up of products requiring registration, and indeed labelling requirements have to be done. There are currently 5 categories of complementary medicines, namely homeopathy, Ayurveda, Unani Tib, phytotherapy and Chinese medicine and acupuncture. But we have seen the promulgation of other regulations just recently. Those categories are not sufficient. Where, for example, would we place products that relate to Tibetan medicine and under those categories? And the definition of complementary medicine is still under some debate. So that is the purview of the MCC. There is a Complementary Medicines Committee, which also is tasked specifically with complementary medicines. And,
are we getting closer to the point where all products would be registered?
I think that's a question for the registrar of the MCC. Okay. I think it will be a long road, but I'm very pleased, and Council welcomes the development.
We're going to have to leave it, I'm afraid. This is Dr. Louis Malinda, Registrar of the Allied Health Professional Council of South Africa. Thank you so much for your time.
Thank you indeed.
All right, time for a quick break. When we come back, we discuss traditional Chinese medicine. Please stay with us.
MedShield Medical Scheme. We don't just talk health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
The Goodman Gallery is celebrating 50 years promoting art from all sectors of life.
Actively involved in social and political life of South Africa, and we really have been. It's been a fascinating place to be and to watch.
Your personal style is synonymous to your signature statement.
Style is unique. It is a representation of you, your personality, the things you like. It speaks on your behalf, and it just represents the kind of person that you are, your uniqueness.
It's hilarious, apart from anything else. It's the satire, the sort of commentary on what we kind of take for granted as we exist daily life.
Vote for Wonder Boy with your heart. Vote for Wonder Boy with your heart and dance at cinemas nationwide.
For your weekly dose of arts and entertainment news, tune into Trends every Saturday from 12 to 1.
Well, they haven't.
No, they haven't.
Do you know why?
Well, we didn't know. Firstly, we'll ask.
I can tell you.
Why?
They say you're selling out.
Why?
Well, I guess that's a question you need to engage them.
Why would the African Union try and separate human rights and women's rights?
Women's rights are indeed human rights.
So we need to be asking ourselves, what kind of society are we? What kind of family structures do we have where parents, where fathers turn on their daughters?
If a policeman, is seen to be accessing psychological services, couldn't that be seen as a sign of weakness?
People are waiting for somebody to discover them.
Absolutely.
And that's not everybody's story, am I right? I mean, there's so many of us who can be the best and stars, but you can't sit there and wait for somebody to say, I think what you're doing is great.
Which are so different to his past.
I really wish I could say thanks to him. And mind you, I'm the man. I make coffee and I'm proud of it.
For your daily dose of current affairs, tune in to the SABC News Channel.
Acupuncture means piercing by needle, and it involves slowly inserting fine needles into the skin. It's a form of Chinese traditional medicine dating back over 5,000 years. This little boy is also here for treatment. His mom says he's hyperactive. Is he scared? Dr. He Purin is 80 years old. He's been doing this for well over 60 years. One by one, patients come into this consultation room. They tell the doctor their problems, and he informs the nurse where she should put the needles, or the acupunctural points as they are known in the field of medicine. The doctor is too old to do it himself. Okay, that looks painful. Actually, it's not really that bad. She knows what she's doing. Well, I don't feel any worse.
This is a complete treatment for a patient with lower back pain and neck pain. This includes acupuncture and cupping. You can see how the cups are pulling on the skin, and what that's doing is actually helping increasing the blood flow, therefore it's helping to relax the muscle, and it's going to help take pain away. This particular patient's been having pain in the lower back for quite a few years, and she has found the treatment to be very effective.
Interesting. So, traditional Chinese medicine is said to be used to treat both acute and chronic illnesses, and includes many therapies and modalities, such as acupuncture, as we saw in the clip. Now, to learn a lot more about this, to be educated on the subject, it's a pleasure to welcome Dr. Annette Simon. Dr. Simon is chairperson of the Allied Health Professional Council of South Africa, but the professional board for acupuncture, Chinese medicine, Ayurveda, and Unanitib. Welcome to Health Talk, Dr. Simon.
Thank you very much.
Now, traditional Chinese medicine is an old tradition, as they say.
Very, very old, Dr. Cello.
Take us through
it's
to the
about
history.
2,000 years old.
Yeah.
Now, the oldest scripture in Chinese medicine is called the Huang Dinai Jin, the Yellow Emperor's Canon of Internal Medicine. And Chinese medicine dates to more than about 2,000 years old. If you take something in account like, I don't know if you're familiar with Utsi.
Utsi? No, I don't.
That is the snowman they found in the Alps.
Right.
And he's estimated to be about 9,000 years old. Now, Utsi has got 17 acupuncture markings on his body. that they have to toot.
Yeah.
In ancient China, it was a practice amongst the acupuncturists to tattoo the acupuncture points.
Right.
And Utsi has got 17 of these markings, and that is the prescription for osteoarthritis of the lumbar area. We still use that today.
Well, talk about that now. Tell me, obviously there's different types. You know, there's Ayurveda, and unfortunately our time is very limited to go into all of these. But just briefly, what do you use acupuncture for?
Acupuncture is used for various conditions. I use it a lot for infertility treatments in my practice. Infertility treatments.
Right.
And also as an adjunct to IVF treatments.
Okay, maybe let's just stay on infertility treatment now and take us through what actually you do there.
Well, we will treat the person according to their pattern diagnosis. Acupuncture in Chinese medicine is quite different in their diagnostic methods than Western medicine.
Okay, let's be practical. Let's say there's this couple that's been married for about 4 years, and they, I would imagine, come and consult you to say, you know, there's a problem. We've been trying over the last 4 years, and we haven't been able to fall pregnant. What then do you do?
Good. We will first have a consultation with them. We will come to a proper diagnosis. Your diagnosis you will derive through what we do: pulse diagnosis, tongue diagnosis.
So who do you examine? The lady or the man?
It depends on where the problem is. If it's with the woman or with a man or with both.
Right.
So then we will examine the patient and come to a conclusion, and then treat them according to Chinese diagnostic principles. The 8 principles of Chinese medicine, we will talk about yin and yang. Is it a disease yin or is it yang? Is it an internal disease? Is it an exterior disease? Is it a cold disease or is it a hot disease? And then also, is it...
So say for argument's sake, you determine that it is a heart disease. What then do you do?
A heart disease we will treat then by draining heat. We will also use herbs that will drain heat from the body.
Very interesting. I mean, obviously, I'm seeing it from a different perspective completely. You know, but is there evidence? I mean, do you measure outcomes for your methods to say, well, I've used these methods, these are the results? Going back to the example of infertility, that this couple came to see you, a year later, you know, the lady's now pregnant. Do you have outcomes to, you know, that you can measure? Yeah?
I am the grandmother of many, many babies. So I've got about a 72% success rate in my practice.
Really?
Yes. Acupuncture really works for infertility. And for
just explain the science behind acupuncture. Then what actually does it do? When you stick that needle in there, what actually happens?
Okay, Chinese medicine rests on the principle of qi. Qi is a vital force that is in the body. Now you get different types of qi. Qi is, a lot of people in the West will say, but I cannot see qi. It's an invisible force. But when you are in your house is wired with electricity wires right through the house. But when you put the light switch on, the light goes on. That is qi. It's an invisible force made visible by what it does in the body.
And then cupping. I mean, I've seen, you know, in the clip we showed that these small cups that are put onto the skin and suck the skin up, as it were. What actually does that do?
Okay, cupping, you get various types of cupping. You get fire cupping, you get stationary cupping, you get moving cupping, you get herbal cupping. There are different methods that we use. Now, in Chinese medicine, you get a condition called blood stagnation. Now, the cups will move the blood. When there's a saying in Chinese medicine, qi is the commander of blood, and blood is the mother of qi.
So what would you use it for? I mean, how would... Obviously, I wouldn't know that I have that condition that you just said, blood stagnation.
Blood stagnation.
So people come into you now. What sort of people come and consult you, by the way? For what sort of conditions where you think of using cupping?
Pain conditions, for instance, I would use it in lower backache, for shoulder pain,
Yeah.
It is very, very beneficial to actually release the muscle spasms. Moving cupping is a very, very beneficial therapy, especially to release those very, very knotty spasms that people sometimes carry in their backs and necks.
Is there a time that you feel that, you know, and I'm going back to that example of you determine that there's a heart condition?
A hot.
A heart.
Hot, like in hot.
Oh, like in hot. Sorry,
Yes.
I thought you meant the heart.
No, I'm sorry.
Okay, and then at some point you mentioned, you know, whether it's an internal organ problem or something.
Yeah.
But the question really is there a time where you feel that, you know, you're dealing with something here that needs referral to conventional medicine? Let's say
yes.
a heart specialist or some other.
Yes, I refer a lot of my patients and go and see your allopathic doctor. I even sometimes refer people with oncology problems, and I say, please go and see an oncologist.
Yeah.
So it is very, very dangerous for a practitioner not to refer. We cannot do everything and we don't know everything. We do what is within our scope of practice.
Yeah. Do you have side effects to any of your therapies?
Not a lot. Sometimes it can happen that a person would, you get a condition called a stuck needle, but that we deal with. And we remove the needle through various methods. If you are well trained, then you know what to do in those type of conditions.
Stuck as in which way?
A needle
you insert the needle and it doesn't come out?
It doesn't come out, yes.
Yeah.
And you deal with that. Also sometimes, once or twice in my practice, I've had people fainting from needles. But that's also a condition that you deal with. You're trained to do that. And you will first remove the needles and you will see that the person regain consciousness again.
And you mentioned, so generally you are saying all the methods are safe, even though there's side effects. There's no fatality.
No, there is no fatality. I know there have been cases recorded about pneumothorax, but if you are a well-trained practitioner, those type of conditions shouldn't happen.
Very fascinating discussion. I learned quite a lot, and I'm afraid that's where we're going to have to leave it for now. Dr. Annette Simon, Chairperson of Allied Health Professional Council of South Africa and Professional Board for Acupuncture, Chinese Medicine, Ayurveda and Humanity. Well, thank you so much for your time.
Thank you very much.
Okay,
Dr.
another
Salo.
quick break. When we come back, we now go and look at acupuncture.
MedShield Medical Scheme. We don't just talk health, we do health.
So good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
For 200 years, homeopathy is said to have been able to address various diseases successfully using pills and medicinal drops and stuff like that. But, you know, we have somebody who knows a lot more about this than I do, and it's a pleasure to welcome Dr. Natasha Wolf. Dr. Wolf is a homeopath and acupuncturist based in Roodepoort, you said.
Correct, yeah.
Right, welcome to Health Talk.
Hello, thank you very much.
Right. Just tell us about the profession. I mean, I see you're a homeopath and acupuncturist.
Yes.
Okay. Now, we just had a discussion on, you know, acupuncture, you know, under traditional medicine. So there's overlap often between these professions. You practice acupuncture, and at the same time you're a homeopathist. Tell us about that.
I hold a dual registration, which is a legal thing that you're allowed to do.
Oh, okay.
So my initial qualification is the homeopathy, and then I did the acupuncture on afterwards.
Oh, I see.
So
Okay.
my primary modality is the homeopathy.
Okay, but you saw the need to add acupuncture as well.
Yes.
Okay.
Yes.
Let's talk about homeopathy. I mean, this is goes back many years ago.
Yeah.
I'm told. Yeah. Tell us a little bit about that.
A couple of 100 years, approximately 200 years.
Yeah.
It was developed in Germany by a gentleman called Dr. Samuel Hahnemann, who was an actual medical practitioner, and he became unhappy with the treatment at the time, which was mostly leeches and vomiting and various things like that. So he started experimenting with various herbal products, and he discovered that the more you dilute a product, the more effective it becomes. So
it's a very difficult
it's a
concept for me
difficult
to understand.
It's a very difficult concept.
What do you dilute?
So he was particularly using herbal products at that stage.
Yeah.
The big one he was using was cinchona at that time, and he discovered, because it's poisonous, it's what you would use to treat malaria. Okay, so in normal quantities, you die. Okay, so he thought, well, let's dilute it a little bit more and keep diluting until we get to the point where the person doesn't have the toxic effects.
So there were a whole lot of people that died before along
Well,
the way.
I don't know if they died, but they got quite sick.
All right.
So he eventually discovered that he could dilute it to almost nothing.
Yeah.
In theory, nothing.
So
Okay.
is that the basis then, the scientific basis behind homeopathic medicine? That it is stuff that has been diluted. Is that the case?
Correct. It is highly diluted medicines that are made from plant, animal, or mineral substances. So the process, there's quite a strong pharmaceutical process. You know, all manufacturing is done under pharmaceutical control in South Africa. And so, yeah, that is how it goes.
Well, and then are all the homeopathic products registered?
Registered as
in with the MCC, because you mentioned scientific methods.
I don't think. See, what happens is I think over-the-counter stuff is registered. Okay.
Yeah.
What happens is all homeopaths have got compounding and dispensing licenses.
Okay. So in
we-
your practice, you dispense.
Yes. So any qualified homeopath will have a compounding and a dispensing license, which is something you have to do in addition, for legal requirements.
Right.
And then you get the base material or up to a point, and from there you will compound and dispense to your patient.
Okay. So what do you use homeopathy for? I mean, okay, I suppose there's thousands and thousands of conditions, but let's pick common ones, the common sort of conditions that people consult you for. Yeah.
So acutes, and acutes means your cough, cold, flu, sinuses, ears, all those kind of things.
Yeah.
You can go on to treat bronchitis and pneumonia, those kind of common conditions, all the way to chronic disease, and then you're looking at more your arthritic conditions, or really any sort of chronic disease, because there's no disease that cannot be helped with homeopathy.
But let's try and maybe use specific examples. Let's go back with acute stuff. You mentioned pneumonia, and that brings in the question for me about diagnosis. How then do you make the diagnosis that it's pneumonia?
All homeopaths are trained in South Africa to make a clinical diagnosis, which means that you are using a case taking and a history, as well as then you can refer to any blood tests or x-rays or further investigations like that.
Okay.
So it would be a clinical diagnosis based on that, similar to what you would get from a GP.
Right.
And then, pneumonia, obviously one would have to decide. If it was a very severe thing, you would definitely refer that kind of patient.
Okay.
It would often be early stages that you could treat.
Okay. And obviously you use then the products. Let's say it's mild pneumonia. The guy is not that sick to be in a hospital.
Yeah.
And you would choose whatever products, And outcomes?
Good. Very good. Yeah, in fact, excellent.
Well, I read one or two articles, I would imagine, where they say, look, studies have been done that indicate that, in fact, homeopathic medicines are no better than placebo in treatment. Your response to that?
There's lots of research that can be for and against.
Yeah.
I've been in practice for 16 years already, and I see the results every single day. and they are really good. You know, I wouldn't be able to do this if I didn't see the results, otherwise I'd be seriously lying to myself. But beyond that, there is a lot of research that is actually in the favor of homeopathy.
Okay, let's go back to chronic conditions.
Yeah.
What sort of chronic conditions do you then treat? You mentioned the word treat, right?
Yeah.
Okay, what sort of, okay, the common ones, diabetes for instance. Do you guys treat diabetes?
Look, you know, I personally will use homeopathy as an adjunct to diabetic patients.
Right.
Okay, the majority of them. If it's an early stage diabetes patient, then in a type 2 diabetic patient,
Right.
okay, which is non-insulin dependent.
Yeah.
Those are the kind of patients that you can reverse it if they're in that initial stage of where their sugar's just in dysregulation.
Yeah.
So definitely you can reduce it and reduce the
what's-
medication they're on.
Yeah. And you know, what does the medication do in a type 2 diabetic, for instance?
You drop the sugar even less than what it would be on their medication, so they can use less of the medication. In some patients, you can regulate the body well enough that they don't need to take the meds in a type 2 patient. Okay.
So you mentioned, I mean, you use it as an adjunct to conventional treatment.
It would depend on what in diabetes is a difficult one because, you know, you have to have that very strict control. So you
Okay, maybe let's choose another
Yeah.
example that, you know, a common chronic condition that you treat successfully. Hypertension?
Hypertension is also one of those that it's similar to diabetes. It depends on where the person is on that scale.
Okay. Maybe let's move away from that one. You mentioned arthritic conditions.
Yeah, okay, it's a bit better, yeah.
Osteoarthritis is very common.
Yeah,
you know,
very
gout,
common.
And that sort of thing. How do you treat that?
Again, various homeopathic medications, and over time, eventually you get to the point where and it depends on the stage of the disease. If the person is still quite in the early stage, you can definitely reverse it before there's strong pathological changes in the joints and things like that. You can reverse and halt the process, absolutely. But if you're at the end stage where you've got the disease changes in the joints, you know, you're not going to suddenly change that by some miracle. It's not going to work like that. But you can definitely halt the inflammatory response that's going on there and help with the pain as well.
You treat weight loss as well?
I do. It's a very common condition all over.
Yeah. Outcomes?
I'm going to say it's very similar to all other professions.
All
It
right,
really
okay.
depends on the person.
All right.
Yeah.
At least you're being honest. That's any side effects of your products? I know they're highly diluted. Yeah?
No, you don't get side effects. You get aggravations from it, which can last a day or two, but that's part of the healing response. So you absolutely do not get side effects, and they can be used 100% safely with almost all conventional medication.
All right. Very, very interesting, Dr. Natasha Wolf. Thank you so much for your time.
Pleasure.
All right. Time again for a quick commercial break. When we come back, we now look at chiropractic. Please stay with us.
If we are talking health, then let's talk seriously. Shield, embracing our members in good health since 1968.
He said as a former born Indian man who falls in love with a white girl during apartheid and the struggles that they face in order to be together. The movie said in the 1970s when interracial relationships were illegal.
You're the most beautiful woman I've ever seen in real life.
Take a journey of love with Mo and Pindi.
Take your life and put it in somebody's hands. And it's not a cowardly act to do.
We kind of knew that it is taking a risk having a relationship with anyone.
Fashion is a reflection of beauty in clothes.
What motivates me to be a designer is because I like fashion a lot.
Join your host Rufulo Mula for that 1 hour weekly dose of arts and entertainment news.
So we're on C5 here. Just relax your boner down a bit more. That's good. And I've got to get in there again. Just drop into my left hand. Lovely. That wasn't too bad, was it? No. Did you enjoy that? How long have you been suffering with this? It's into your right shoulder. Yes. Okay, this is called torticollis for the sake of the student. How long have you had this problem?
For a day now.
For a day. You've never had it before?
I had it before, but the doctor said that it was, first time I had it, they said it was frozen shoulder.
Frozen shoulder.
They said it was torn ligaments.
Torn ligaments. So what we have here is a torticollis off to the right here. Keep your arms up there, my dear, if you can. So we actually come on top of the rainbow. You have to adjust on the concavity side. And you go very slowly with the patient. You take a long time to set up. Go very slowly. Just let that shoulder go a little bit, my dear. Just let it go. I'm sure they heard that across the road. There was a huge adjustment. Now tell me, how does that feel?
I don't believe this.
You don't believe it? Huh? And you've been suffering for how long?
For this time, one day, and this is the second day.
Is that right?
Scary stuff, if you ask me. Well, spinal manipulation is said to have been used by the ancient Greeks long ago, before it was incorporated into chiropractic and osteopathic medicine in the 19th century. Now, here to tell us a lot more about these procedures, spinal manipulation and so on, let's welcome Dr. Luke Schmidt.
Thank you.
Who's a chiropractor. Yeah, welcome to Health Talk.
Thank you for having me on, and good morning to all the viewers.
Right, you guys break people's necks, man. I mean, that sounded very scary. Huh?
I think that video does go and make that seem a bit worse than what it usually is.
Yeah.
That was a torticollis patient there.
Yeah.
When it comes to torticollis, I always say to my patients, have you seen a chiropractor before? Chances are, seeing a chiropractor when you have a torticollis is one of the not the worst times to be seeing a chiropractor, but one of the most painful adjustments. Adjustments are not painful.
Yeah.
You ask your patient after an adjustment, was that sore or did you get a fright? 9 times out of 10 they'll say, I got a fright. That was it. Not painful. And the relief they receive from a manipulation or an adjustment is incredible, actually.
Well, let's talk about that. You mentioned torticollis. What sort of conditions do you guys treat? I mean, I know lots of people with backache, for instance, come to you.
Well,
what sort of conditions do you
chiropractors mainly look at, our bread and butter is basically low back pain, mid back pain, neck pains. You're often looking at any sort of joint pains, sporting injuries. A lot of the sports athletes, Usain Bolt, for example, golfers, all use chiropractic to help improve their performance. You're looking at certain types of headaches, cervicogenic headaches, where headaches pretty much originate from the base of the neck there. You're also looking at...
So okay, let's focus a little bit on headaches. We'll come back to backache just now. Headaches, diagnosis. And I ask the same sort of questions. How do you get to a diagnosis?
Well, once again, you look at a presenting complaint. It's a full case history done on the patient. We can send for blood tests, x-rays. We can come from the diagnosis from an x-ray as well. We're also looking at orthopedic tests. Orthopedic tests are incorporating certain tests in where we describe the motion of the joint and see which way the joints are moving or not moving. Chances are in headache patients, you're generally looking at that C0, C1, C2 joints that aren't moving correctly, especially in the cervicogenic headache patients. You're looking at any sort of spinal, cervical spine restrictions, which can go and refer pain up to the head. Okay. It's not just that, it's looking at...
I mean, you can inter-refer, isn't that so?
Oh, of course, yes, we can inter-refer. Often what happens is people have tried the mainstream medication and say, I get temporary relief from it. What can chiropractic offer me? We can't guarantee a result in treatment. What we can offer is an alternative form of treatment. And often we see that patients are responding very well to the treatments. Sometimes they just do need their spinal joints manipulated or adjusted in order to activate those mechanoreceptors within the joints, which goes and fires up to the brain or through the neurological system, just to tell the brain, listen, we're moving, we're working, we're happy, let's carry on.
So the basis for the chiropractic treatment is really about spinal manipulation. Is that it?
That is one of the crux of the chiropractic treatment, yes. Spinal manipulation. We also look at dry needling, soft tissue therapy, some chiropractors look at strapping as well, joint mobilizations, anything that is pretty much neuromusculoskeletal, looking at a hands-on therapy. Chiropractic actually means, it's the Greek word for done by hand. So,
and you use your hands other than those needles? I suppose,
other than the needles for dry needling. Some chiropractors do use what we call an activator tool, which is it mimics the adjustment. It's a handheld device that actually goes and you contact that onto the spinous process or the transverse process, and you go and click it, and it sends through an impulse into that joint to get that joint moving again.
Okay. What sort of sports injuries then do you treat?
Muscle tears, tendon injuries, any sorts of sporting injuries. You're looking at, often sportsmen tend to use chiropractic as a preventative measure. Studies have come out of America showing that the sports teams who have a chiropractor on board, as well as their medical doctors and their sort of allopathic approach, the sports teams who have chiropractors on board tend to show fewer injuries throughout the season.
As a prevention. But I mean, you mentioned muscle tears. What do you do for a muscle tear? I thought you focused a lot more on the joints and the spine.
Now you need to remember that in chiropractic there are over 300 different types of techniques. One of the many techniques that they use is Graston as well. Graston or Factor. Correct. Where it's using a handheld blade to rub along the muscles. You're looking at fascial release, any sort of strapping to go and help correct the muscle dysfunction, or stabilizing the joint to prevent that muscle from being overused.
So how do you treat a muscle tear then? Somebody comes to you as a sprinter and has a huge strain and a huge muscle tear.
You can look at, often what happens is when there is a sort of dysfunction in a certain muscle or joint, other muscles tend to compensate. So they start tightening up to try and prevent that joint from moving excessively, or to try and just go and protect that area to prevent further tearing of that muscle. So what we can look at doing is dry needling of the tightened muscles, massage therapy of the tightened muscles, strapping of the torn muscle. For example, there may even be bruising. Kinesio tape has been shown to be effective in terms of decreasing the bruising.
I mean, a lot of the things that you mentioned is what physiotherapists would do.
Yes, correct.
Do you work alongside physiotherapists for this?
By all means, we work alongside physiotherapists. Our main focus as a chiropractor is obviously the spinal manipulation. However, our scope of practice is set to include any sort of conservative approach to neuromusculoskeletal conditions. So by all means, yes, you find chiropractors and physios do interrefer a lot. I mean, often sort of taking a combined approach is one of the best options. Chiropractors are certainly not against physiotherapies or physiotherapists. So
we're going to be doing a show on backache soon, and I mean, obviously this is a very common condition.
Yes.
And it appears that it's one of the very commonest reasons for consulting a chiropractor. Tell us what you do for somebody with backache.
All right. Once again, you first take in the history. You want to find out if it's an acute or chronic condition. Often people tend to let their low back pain just sit and wait for years and years, and it's wrong, because they should be getting, the second they have back pain, they should be getting that checked out. Just for example, if you're getting toothache, what are you going to do? You go to the dentist. Why are they not going to the chiropractor the second they start getting back pain? And the chiropractors are spinal healthcare experts in their field in terms of conservative approach. So what we do is we go and assess the patient, see what's going on. When did the complaint start? What happened? Were they picking up something? Was it from a traumatic incident? Are there any fractures that we may suspect? Is there any sort of pathology that we may suspect behind the lower back pain? Or is it straight up mechanical? Okay, we can refer for x-rays to help further our diagnosis or to help better our diagnosis. We then go and look at focusing on sort of what we call vertebral joint dysfunctions or restrictions, where we go and basically apply an adjustment, which is a high velocity, low amplitude thrust into that restricted joint.
Okay. Now, the clip that we showed,
Correct.
showed this manipulating of the spine and that sort of thing.
Yes.
And I mean, I jokingly said, you guys break people's bones. But seriously now, I mean, are there any side effects to your, therapy methods? I mean, do you ever...
Yeah, as with any sort of healthcare profession, there are possible side effects and adverse effects.
Yeah. What sort of adverse
you're looking
effects?
at, you could be looking at bruising, post-treatment stiffness, especially from the adjustment, especially if you haven't been adjusted before. What happens is you may be going and tearing sort of adhesions between the joints. That can go and cause pain or stiffness for the next day or two, but that does go away. It's basically like feeling like a gym sort of stiffness. That's what patients describe it as.
Ever had permanent disability as a result of a side effect to your treatment?
Are you talking about me or as in
Well,
general?
chiropractic.
There have been a few reported cases. However, there's a study that's come out of the Palmer College of Chiropractic in America, which shows that the chance of that happening is 1 in 5.85 million.
All right, so very, very, very low. Okay, well, Dr. Luke Schmidt, thank you so much for your time.
Thank
very
you. Thank you for
fascinating
having
talk.
us, yeah.
Educational. Right. Folks, it's on that note that we come to the end of our show today, unfortunately. And join us again next week on SABC News. And remember to please share your views and comments with us via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember that you can watch today's show at 2 p.m. today, and again next Thursday morning at 5 a.m. I'm Dr. Salome Down. Thank you so much for watching. Right.